Assessment assesses the client's ability to move independently. Assesses the client's flexibility. Assesses the client's age, medical diagnosis, cognitive status, skin integrity, nutritional status, continence, other sensation, as well as the overall condition of the musculoskeletal system. Assesses for presence of tubes, incisions, and equipment. Assesses for physician's order for specific restrictions regarding client positioning. Next, gather all necessary equipments like pillows, rolled towel or blanket, footboard, decanters, hand rolls, and gloves. So in this case, since we are not in a hospital setting, I just improvised some of the equipments. Now that we all gathered all the necessary equipment, I will now proceed to perform hand hygiene and put on PPE if indicated. Also, introduce yourself to the client and verifies the client using at least two identifiers like name and birth date or name and identification number. Compare identifiers with information on the client, medical record, or client's identification band. Explain the procedure to the client and encourage to participate as appropriate. Closes the room door and curtains around the bed if possible. Assemble equipment at bedside. Raises level of bed to comfortable working height. Lower the side rail and assist client in side lying position. Removes all pillow and devices used in previous position. Plan the moving technique. Obtain any needed supportive devices or assistance. Follow proper body mechanics guidelines. May I come in?
Yes, nurse.
Good afternoon, ma'am. How are you?
I'm good, nurse.
I'm Magsino po, and I'm here to assist you today. Can you tell me your name po?
I'm Cassandra Santos po.
Your birthday po?
July 29, 2007.
Thank you. So today I'm going to position you into supine. Is that all right with you?
Yes, nurse.
So good afternoon, ma'am. I'm Magsino, and I'm here to assist you in positioning in supine position. Is that all right?
Yes, nurse.
Okay. So first step in positioning the patient in supine position is to lay the patient flat on the bed. Next is put a pillow under the head of the patient. Next is put pillows under the patient's forearm. And do it on the other side also. Put hand rolls underneath the patient's hands. Next is put a rolled towel in lumbar area of the patient's back. After putting a roll towel on the patient's back, we will proceed on putting a trochanter beside the patient's thigh. And to the other side. Next is put a footboard onto against the patient's feet, making sure that the toes is pointing upward. So now we position our patient into supine position. Good afternoon, ma'am. I'm Kelly Magsino, and I'm here to assist you to change your position from supine position into Fowler's position. Is that alright with you?
Yes, nurse.
Okay. So the first step in changing our patient's position into Fowler's position is to elevate the bed. But since we are not in the hospital settings, we will just elevate our patient using pillows. So first is to add pillows until it reaches approximately 45 degrees. And for semi-Fowler's position, we just have to elevate our patient until the patient's head and trunk are approximately in less than 45 degrees. For high Fowler's position, let's add pillows to elevate our patient until it reaches approximately 60 to 90 degrees. So in high Fowler's position, it is often looks like the patient is sitting. Good evening, ma'am. I'm Kelly Magsino, and I'm here to assist you to change your position into dorsal recumbent position. Is that all right?
Yes, nurse.
Okay, so first is to place our patient into back lying position and slightly elevate by putting a pillow under the patient's head and shoulders. Next is to place the patient's arm onto her side, in her side. Next is to raise the patient's legs and separate them. Make sure that the feet is laying flat on the bed. Next is to cover the patient to provide privacy. Now we position the patient into dorsal recumbent position. Good afternoon, ma'am. I'm Kelly Magsino, and I'm here to assist you to change your position into lateral sideline position. Is that alright?
Yes, nurse.
Okay, so first position our patient into her side. Yeah. Next is put a low pillow to support our patient's head. Next is a top pillow along the patient's back. After that, bring the underlying arm forward and flex it on the pillow used for the head. Next is put the other arm forward in front of the body and flex it. Next is put pillow under the patient's leg and flex it slightly forward. Next is put hand rolls onto the patient's hand. And put trochanter to support the patient's feet. So now, we have positioned our patient into lateral side lying position. Good afternoon, Ma. I'm Magsino, and I'm here to assist you to change your position into Sim's position. Is that alright?
Yes, nurse.
Okay, so first is to position our patient onto side lying position. And turn our patient far enough onto her abdomen so that the arms is extended behind the patient's back and both knees are flexed. Flex the upper leg slightly farther than the lower leg. And put folded towel onto the patient's shoulder. Next is to put the patient's head onto the side. After that, put hand rolls onto the patient's hands. And next is put trochanter onto the patient, underneath the patient's leg for support. So now we position our patient into Sim's position. Good afternoon, Ma. I'm Magsino, and I'm here to assist you to change your position into prone position. Is that alright?
Yes, nurse.
Okay. So first is position our patient onto her abdomen. And place the patient's head onto the side. And put folded towel on each shoulder of the patient. After that, put hand rolls underneath the patient's head. And flex both hands beside the patient's head. After that, put a trochanter underneath the patient's leg. And lastly is to put blanket on the patient to make sure that our patient is warm. So now we position our patient into prone position. Now that I have done implementing the therapeutic positions, I will now proceed on evaluation. Safe and proper body alignment and movement were achieved for both client and caregiver. The client is comfortable in the new position as evidenced by verbal and nonverbal cues. The client's skin and underlying organs and tissues were protected from pressure, friction, and shear.
nurse.